Thank you, Mr. Chairman. Secretary Shulkin, I saw your profile piece in the New York Times this week, and a story within it really caught my attention. When you asked for a summit on veteran suicide, you were told by staff that it would take at least 10 months to pull it together. And you pushed back on your staff and said, you need to do it in 1 month. The Times story notes, and I quote from it, when his staff members pushed back, he pulled out a calendar and began quietly tapping, then showed them that during the delay, nearly 6,000 veterans would kill themselves, and they got it done in a month. I think I speak for my fellow committee members when I say that it is that sense of urgency that we admire, and that sense of urgency that we expect and demand also from the VA in general. The same sense of urgency is one that I want to talk to you about with regard to the scheduling delays with the Choice program, and specifically with the third-party administrator, HealthNet. As you know, I recently wrote you about HealthNet's constant delays, their mistakes, and their outright failures. I asked you to transfer the responsibility for scheduling appointments for Wisconsin veterans from HealthNet to the local VA medical centers, who have told me that they have the capacity to schedule these appointments. And you denied that request. But I wanted to today give you some examples of why I asked for the removal of HealthNet from the scheduling process. 10 months. That is the amount of time it took a female veteran to get a mammogram scheduled through HealthNet. From September 2015 to June 2016, a veteran waited for a mammogram. This includes an intervention from my office on her behalf to get this scheduled, utilizing an escalation telephone number provided by HealthNet. That escalation line has since been disconnected. Just this week, I heard from a veteran who was authorized to use the Choice program to see an orthopedic surgeon in March. HealthNet received the authorization from the VA, but never contacted the veteran. When the veteran contacted HealthNet, they informed her that the authorization had expired. So the veteran was kicked back to the VA, and she has still not seen an orthopedic surgeon. Another veteran with a 100% service-connected disability wrote to me and said, I have been referred to the VA Choice program 4 times. 1 time worked perfectly. That's good news. The other 3 were nightmares. HealthNet told him that he would receive a call back in 5 days to schedule his appointment. They never called back, so he called them. HealthNet told that veteran they would call back with his appointment. They never did. That happened 4 times. When HealthNet did finally set up the appointment, it was with the wrong doctor 3 times. These HealthNet failures are harming our veterans. They're getting in the way of the care that our veterans have earned, and they are giving the VA a bad name because very few people differentiate between HealthNet and the VA. I met with all 3 of Wisconsin's VA medical center directors just a few weeks ago, and each one of them told me that they have the capacity to schedule these appointments at their facilities directly. Given all of this, I'd like to hear why you denied my request to remove HealthNet from scheduling appointments in Wisconsin, and I urge you to reconsider that decision.
Okay, I've reconsidered. No, thank you for your sense of urgency on this. You're absolutely right, and those stories are horrific, and I wish I could tell you that they were rare. So I think you're right on this. We entered into a contract where essentially we outsourced this customer service, and we have learned the hard way that good businesses don't do that. In our new system, we're going to release a new RFP for contractors that will be released in June. You will see that we are asking to bring that back to VA exactly like what you're talking about. So We're talking about managing a current contract during a remaining period of time until we issue our new RFP. We will move forward. We have piloted exactly what you're saying with very, very good results in many locations around the country. And the reconsideration, we will move forward with the pilot in Madison. I wish we could do, what's that?
All of Wisconsin.
I wish that we could do all of them. We have contract issues with our contractor because we signed a contract with a process that outsourced this. They have been willing to work on pilots with us, so right now I can tell you we're working towards that in Madison. The new program will have it all back in, and I think you're absolutely right. I do share your urgency on this. We are seeing improvements. We're seeing less of these stories than we did before, but any of these stories aren't acceptable.
Mr. Chairman, I see my time has run out. I do have questions I will submit also for the record.
Thank you very much, and thank you for expressing the concern on behalf of those experiencing health net problems. Our provider is Tri-West, and our circumstances are different, better, and I would encourage the Secretary and the Department to do everything they can to solve this problem, as described by the Senator from Wisconsin.